I would like to welcome everyone again to the 15th Asia Pacific Sociological Association 2-day webinar on COVID-19, climate, and health. Our session today is broadcasted live on the Facebook page of APSA 2020 as seen on your screens. Please be guided of the house rules for today's session. All guests and participants are automatically muted upon entry. The ceremony will be recorded for documentation purposes. For panelists, please keep your video off and your microphone muted, especially if it's not your turn to speak. For panelists also, you will be hearing my voice when you have 3 minutes left. You'll also be hearing this bell when you have 3 minutes and again on 1 minute. For attendees, please send your questions through the Q&A section at the bottom of your screen so our team can note this and raise it during our open forum. I'd like to remind everyone that the Book of Abstracts is now available online. You can access them at bit.ly/APSA 2020 BOA. That's bit.ly/APSA 2020 BOA. I'd just like to clarify that there are no presentation slides seen. If you want to check out the program for today, you can visit them at bit.ly/APSA 2020 Manila. That's bit.ly APSA 2020 Manila. Our team will be sending these links on the chat box for your ease of access.
Ina, can you please continue? I think Denise has technical difficulties.
All right, thank you. If you go over the program, we begin this webinar with the welcome messages from the Ateneo de Manila University President, Father Roberto C. Yap, who is also the project holder of the Coastal Cities at Risk in the Philippines, Investing in Climate and Disaster Resilience Project. Before we do start with the welcome messages, I'd like to reread the house rules as it's already seen on your screens. So again, all guests, especially for the new comers, all guests are automatically muted upon entry. The ceremony is being recorded for documentation purposes. For panelists, keep your microphones off and your videos turned off and only use it when necessary. A bell will be played when you are in your 7th minute and only 1 minute left in the presentation. The bell sounds like this. For attendees, please send your questions through the Q&A section at the bottom of your screen so our team can note this and raise it during our open forum. Please address your questions to specific panelists if you have them in mind. I'd also like to present to everyone that the APSA 2020 Book of Abstracts is now available online at bit.ly/APSA 2020 BOA. If you want to go over the event program, you may visit bit.ly/APSA 2020 Manila. We begin this webinar with a welcome message from the Ateneo de Manila University President, Father Roberto C. Yap, who is also the project holder of the Coastal Cities at Risk in the Philippines, Investing in Climate and Disaster Resilience Project. May we now play his video.
On behalf of the Ateneo de Manila University community, I welcome you to the 2020 webinar of the Asia Pacific Sociological Association. The global COVID-19 pandemic has affected all aspects of our lives and will continue to do so for many years to come. I am therefore pleased to know that you have chosen to focus on its impact on our society, especially on our health systems and climate and disaster resilience. As you yourselves have stated, the pandemic's impact is worse on socially vulnerable groups. And if we hope to mitigate this, then we have to begin with an understanding of its far-reaching effects on our social systems. The breadth and depth of sociology is crucial to this understanding. Your study and research into human social relationships and institutions can help guide a response to the complex challenges facing our world guide the crafting of governmental and institutional policies to address these issues, and guide strategies for extensive uptake of possible solutions. In her brief message in the webinar poster, the APSA president, Dr. Miwako Hosoda, challenged you to collaborate with the entire society in the search for actions that can help to cope with the dramatic situations faced all over the world. I echo this challenge and look forward to hearing about more interdisciplinary projects involving members of your sociological associations for the benefit of our region and the world. Again, welcome to APSA 2020 Manila, and I wish you all an illuminating webinar.
Thank you very much, Father Bobby. We now welcome Dr. Melanie Robertson, the Senior Program Specialist of the Climate Change Program of the International Development Research Center, Canada, or IDRC. Play video.
Good morning, everybody. I'm Melanie Robertson, a Senior Program Specialist at the International Development Center, IDRC. IDRC has been proud to support the project Coastal Cities at Risk in the Philippines. I'm delighted to have the opportunity this morning to thank Dr. Roberto Yap, President of Ateneo de Manila University, and Tonia Yulo Loizaga, President of the National Resilience Council, and Professor Miwako Hosoda, President of the Asia Pacific Sociological Association, for supporting this webinar and also for supporting the project. Also a special thank to you, Professor Emma Porio, and all her team of researchers and collaborators for their fantastic work and dedication since the beginning of this project, and even more during this strange time. With the global pandemic, we are experiencing challenges in every sphere of our lives. I'm really impressed on how the researchers have adapted to the situation and have continued their work with passion. The time of this webinar on COVID-19, climate and city are timely and much needed in these difficult times. It is an extremely challenging moment for cities, with the clock to develop and implement policies aimed at slowing the virus. It can be seen everywhere that the situation of specifically socially vulnerable groups have become more difficult and environmental issues more serious. COVID-19 and climate change are both urgent crises, and plenty has been written already about the similarities between the two, with much more sure to come as lessons from the pandemic emerge. This is a moment of opportunity to marry the best of city climate policy and virus response. While big policy conclusions, connections, and questions will continue to be debated, right now there are important observations to be made and potential lessons learned for city policymakers. This conference explores some of these intersecting areas crucial for our collective work in academia, but also at IDRC. I'm wishing you a great conference with rich debate that I will follow from Ottawa in Canada. Thank you for your attention.
Thank you very much, Dr. Robertson, for the message. Indeed, we are very grateful for the support of IDRC. We now welcome Professor Jose Joel Canuday, the Associate Professor and Chair of the Department of Sociology and Anthropology at Ateneo de Manila University and co-convener of APSA 2020. May we now play his video.
Father Zakia Hossain of the University of Sydney in Australia, Emma Porio of the Ateneo de Manila University, Surichai Wun'Gaeo of the Chulalongkorn University in Thailand, and Jessica Dator-Bercilla of the University of the Philippines. Good morning. In a seemingly one quick blow at the end of the northern winter months this year, we collectively saw the borders of the world shattered as the new strain of coronavirus cascaded its way across continents. Global flows were upended, movements of people severely restricted, and supply chains disrupted. Humanity braced for the worst with the direst of predictions ranging from widespread hunger in the poorer regions of the global south, breakdown of the national order of things, and the end of our freedoms. Indeed, we are seeing these predictions unfold, but in deeply disproportionate terms. We do see sufferings, precarities, and uncertainties transpiring, but again, in ways that further unravels already existing structural conditions highlighted in countless of sociological papers. In many ways, we collectively saw and experienced the destructive impact of the virus, not as a matter of surprise, but knowing fully well its historical antecedents and trajectories. The analytical frames of sociology have long pointed and tracked the complex but intimate interconnections of seemingly ontological opposites covering the biospheres and the social-political worlds. We have known how diseases and other epidemiological conditions are as much shaped by germs and microorganisms as they are by relations of power, or how a climate is as much a mixture of chemical elements powered by earthly forces as they are political categories shaped by the forces of power. Biospheres and chemospheres are as much ecological and chemical, but also domains of social, political, and economic relations. Yet, on the other hand, it is also an arena, an area that we need to do more work and to offer wider and deeper understanding on these dynamics as they come in play on the ground within and across the borders of our engagements. The two-day webinar on COVID-19, climate, and health, the 15th Asia Pacific Sociological Association Conference 2020, more aptly captures the conditions that we know, but perhaps we also know less. It is in the spirit of knowing and that cry for an even deeper means of discussion and understanding that the Department of Sociology and Anthropology of the Ateneo de Manila University feel honored to take part as hosts of this acutely relevant online event. I wish that we, sociologists and anthropologists, would have co-beneficial exchanges in the 2 days that we will be engaging with each other for knowing and learning from each other's work. Welcome to the Ateneo de Manila Online and a well wish to insightful engagements. Thank you very much.
Thank you very much, Professor Joel. Thank you for reminding us of the importance of sociological research,
Father Roberto
especially
Yap,
in a time of
President of
global
Ateneo de
pandemic.
Manila University.
Now we move to the live messages of our conference chairs. Starting from the main conference chair, Professor Emma Porio of the Department of Sociology and Anthropology, Ateneo de Manila. The project leader, and she's also the project leader and principal investigator of the Coastal Cities at Risk in the Philippines project.
Good morning, everyone. I would like to thank Joel Canodoy for laying out the intellectual landscapes and intellectual frames that we should examine and view the pandemic in our midst and how it has transformed basically the political, economic, cultural, and social landscapes of our time, especially in the cities, and its impacts to the vulnerable poor. Welcome to everyone who was not with us yesterday. Welcome to APSA 2020 webinar. In behalf of our President, Father Roberto Yap, the APSA President, Professor Miwako Wosoda, and the IDRC Program Officer, the Melanie Robertson, and our partner of the university in the National Resilience Council, Antonia Yolo Loizaga. We would like to thank everyone for making the APSA 2020 webinar series a good one to have today. To our partners in the universities of Shisha University, University of Sydney, Chulalongkorn University, University of the Philippines and the Visayas, and the Philippine Sociological Society, and of course my university, we would like to thank you for your generosity in hosting this webinar with us. And to all our speakers, we owe you a great gratitude for your intellectual generosity, because without your contributions, this wonderful discussion of the issues about the COVID pandemic would not have been possible. So thank you very much. I would like to welcome you again to the Ateneo de Manila, to the other universities who are co-sponsoring this event with us. Thank you very much. I'm very grateful to the generosity of support from our partner universities, our conveners, and basically all the people have made this possible. Thank you very much.
Thank you very much, Dr. Porio, for that wonderful welcome remarks. Now I welcome the co-conference chair, Professor Miwako Hosoda, who is also the president of the Asia Pacific Sociological Association and vice president of Seisei University, Japan.
Thank you very much. On behalf of the Asia Pacific Sociological Association, I'd like to welcome you to the 15th APSA conference. We have more than 360 enrollment this time. Also, there is more than 1,000 views from our live stream website on Facebook page. I think this is the biggest number of the APSA history. First, I truly appreciate Professor Emma Porio of the Ateneo de Manila University and her team for hosting this online conference. I also express my sincere gratitude to Father Roberto Yap, President of Ateneo de Manila University, Dr. Melanie Robertson, Senior Program Specialist, Climate Change Program, and Professor Jose Joel CODI, Associate Professor and Chair, Department of Sociology and Anthropology, Ateneo de Manila University. I deeply thank our co-host organization for their support. Thank you. For the past 3 decades, APSA has been working to increase academic exchange of sociologists in the Asia-Pacific region, encouraging them to learn and share research results and to understand and overcome social issues. From the beginning of this year, COVID-19 continues to reflect worldwide. It can be seen that socially vulnerable groups, such as people with illness and disability, gender and ethnic minorities, low-income households, refugees, and people living in slums have been suffering from serious socio-economic and environmental problems due to COVID-19. The presentations of day one were very informative and provided insight into countries' specific experience, such as Vietnam, Japan, India, and the UK. I got to know the role and effect of governmental policy and vulnerability of people who lost their job, place to live, suffer from stigma and discrimination. Today, also, we invited distinguished guest speakers. We hope to discuss with you on the issues related with COVID-19 from sociological perspective. Thank you for your participation. Let's learn together. Enjoy the conference. Thank you.
Thank you very much, Professor Miwako. May I now call on the co-convener of APSA 2020, Professor Surichai Wun'Gaeo, who is also a professor of sociology and director of the Center for Peace and Conflict Studies, Chulalongkorn University, Thailand. I welcome Professor Surichai to introduce our panelists.
Thank you very much. They are all our esteemed audience, and I follow the president of our APSA Association, Professor Miwako, in expressing our gratitude to this possibility of having this event, despite all the difficult context that we are in. And it is extremely important that we are able to listen and share our experiences through the very important presentations. We, in our program today, I will have to welcome all the speakers to the second day of our event, APSA webinar on COVID-19, climate and health. The theme focus on climate, COVID-19, and the city challenges to recovery and resilience. In today's presentation, we will be joined by Madam Tiparat Nopaladarom of the Community Organization Development Institute of Thailand, Dr. Lay Wilson of the University of Sydney, Ms. Jessica Dator-Bercilla of the University of the Philippines, Visayas, and Dr. Emma Porio of the Ateneo de Manila University, joined by yours truly, all of you. So now may I begin with Mrs. Tiparat Nopaladarom, please. คุณนพรัตน์ครับ
สวัสดีค่ะอาจารย์
ขอเชิญเลยครับ
ค่ะ
I need maybe I need one line of additional introduction. Mrs. Tiparat was the director of this public institution called Community Organization Institute for quite a long while, and now she's the executive director of executive board of National Health Commission of Thailand. Certainly this relates to how COVID action are needed, and also she is a member of the advisory board of the CODI. Yes, please, may we welcome Kun Tiparat now.
Okay. Thank you, Dr. Surichai and Dr. Emma, for let CODI share this panel. I think that before I start, let me introduce a bit about what is CODI so that I can understand that what we work with the community organization in Thailand. We are the public organization and what under the Ministry of Social Development and Human Security. The CODI mission is to support and to assist community organization and their network to improve standard of living, and also provide financial support to community organization and their network. The example of the current development is one of the major program of CODI is the citywide slum upgrading, or we call in Thai the Baan Mankong, and also support other important issue like the community welfare fund, the sub-district community organization council, and also the secure rural land housing for the rural poor, and community organization certification, and also rehabilitation of disaster affected community and also others. In Thailand, the citywide slum upgrading or the collective secure housing for community launched in 2003, implemented by CODI. And this is the National Collective Housing Program under the Ministry of Social Development and Human Security to solve the housing problem of the country poorest urban citizens, and now also the rural citizen too. The main concept of the program is that the community have to be the core actor for community development, design, and planning for the collective new communities. So the Baan Mankong, or the collective housing program, actually is to build a new and secure community for communities. So this will provide affordable housing for the urban poorest community to have the collective land ownership or lease, and also promote community saving and fund to done all the welfare activity for the member, and the collective management so can empower community, and the community can active link with community network and city organization have active citizens. So this is the example of the canal side that we support the squatter to build the new housing communities along the canal side. And the COVID-19 situation in Thailand as of October 5, 2020, after the pandemic, we have the country have the state of emergency announcement, and we also have the Center for COVID-19 situation administration, and the controlling is quite good, the controlling of the situation, because from 15 we can see that we can maintain and control, and we have the 0 case in Thailand. Up till now, we have just about 3,600 cases in Thailand, and it's about 59% that pass away, and it's recovered more than 3,000 people. So the case is quite good. However, the lockdown policy of the country also have very big impact to the urban poor community. So they have the food scarcity, the debt increase because they lose job. We found that the homeless increasing. They especially for the urban poor, they have the market difficulty from the business lockdown and also the transportation disruption. We have the survey of canal side community under the CODI program, about 3,000 members that affected from CODI, from COVID-19 pandemic or not. And the answer is yes, more than 92% affected from this. And how they affected from this? They lay off 15 participants from the 887 participants that answered this question is that they are laid off and also suspended from work or furlough. And the maximum portion is that they have income less. So this effect on the living condition. But however, in Thailand, we have the spirit and also the sharing spirit to the people. But anyway, the donation not enough for everyone. But the committees under the Baan Mankong program, they organize the way that try to provide all the donation for the most difficult family or the vulnerable group first, like the elderly person or the able person. The committee in Baan Mankong housing program, what they do is beyond housing, because they have the community network, they used to be organized together, they have the community fund, and they have their own saving, which is not much. But anyway, they still not wait just for the other people to help or the community. They start to help and support each other and sharing. And then they start also that how to solve the problem of food scarcity in their community. They start the urban farming in their own community. So what they do is that they try to organize themselves, do many things, like the community kitchen start from their own first. So CODI relief. So CODI start the program to relieve the measure to assist community organization affected by the COVID-19 pandemic, and also to empower and strengthen community to take care of the problem and also to tackle with this. We have the 6-month moratorium program on housing repayment for the community that use the loan from CODI, and also return the 10% interest paid in the last 6 months to 460 community organizations that get the loan from CODI. And the last one is the support the program of quality of life for the low-income community, both in urban and in rural, to deal with immediate trouble, expense reduction, and also job creating. We support 234 city or sub-district in Thailand, in the urban area, and also the more than 1,500 sub-district in the rural in order to cope with this problem. So the community start all the community kitchen so that they can take care the member in their own, and this is all done by the community themselves. They change from the affected people to the problem solver. So set up the mechanism to solve the problem and also to provide the short-term assistance to their member and also other community nearby. And change from the receiver to giver, developing the system on distributing food to community, creating food space from common space in the community. And then they change from crisis to opportunity in order to assist the poor and disadvantaged of community, and linking community network to long-term solution, and also to sustainable resolution and management system and good governance. So this is the distribution of from the community that they can provide more than 100,000 packaged food per month. So we can see here the example of the collective community plantation for community food security. And this lead to the idea of the people that how they can have this kind of long term, so they can cope with the problem if we have the disaster again or the pandemic again. So this is the example of food sharing. So it's build a partnership from this, and can fulfill the gap and sharing spirit and exchange among the community themselves, use of the community space, and also make use from the community fund and reduce their expense. So not just only food, they have the alcohol sharing, mask sharing. The community start to make the mask themselves and also support to other community that doesn't have enough. And also work with the public health volunteer to have the health check in the community, and also educate for the member about the health, how to take care themselves, how to prevent themselves, and collective community cleaning together. So that's the end. Yes, thank you very much for give us the time to sharing.
Thank you very much, Professor Thiparat, for your wonderful presentation. I now call back Professor Surichai again to introduce our next speaker.
So now we, after Kuntiparat, we now would like to follow the program by inviting our next speaker, Dr. Lei Wilson, the senior lecturer from School of Health Sciences, Faculty of Medicine and Health, the University of Sydney, Australia, to share with us the impact of COVID on the environment and the related issues of well-being. Please, Dr. Wilson.
Thank you very much. Professor Surichai, can you hear me?
Yes, I can hear you. Thank you very much.
Trying to share my screen here. I can't seem to get my PowerPoint up for some reason. I'm not sure why this.
So, excuse me, but I try to do this. Now it's open. Can you see the screen?
Yeah, I can share this. I can see.
Yes.
We'll use those slides, that's fine.
It's on now.
So, Dr. Wilson, please tell me the next slide or something when you want to turn the slide.
Yeah. Well, thank you very much for the opportunity. I'm sorry this is not working as well as it could be. And I'd like to thank Professor Surichai, Professor Emma and Professor Muaku for the opportunity to speak to you today. So I'd like to talk to you a little bit about COVID-19 and how it's affected us here in Sydney, Australia, and just a little bit about some of the data that we did and collected during our survey. Next slide, please. So in Australia, the Director-General of Health declared the outbreak a public health emergency of international concern at the end of January and a pandemic on the 11th of March. On the 15th of March, the Prime Minister stopped all incoming seacraft without department approval. And this was because we had quite a lot of ships coming into Sydney to the harbour and disembarking international passengers. And on the 18th of March, the cruise ship, the Ruby Princess, docked in Sydney, and it had many passengers that were experiencing fever or illness. A lot of those passengers were extremely unwell and were allowed to travel home except those that were really unwell. And these were transported directly to hospital. And the number of cases that resulted from that led to a Royal Commission being undertaken. Next slide, please. So the Ruby Princess ship was the initial epicentre of the Australian outbreak of coronavirus. There were 22 deaths and more than 600 confirmed cases, including 153 crew members. And the ship was stranded off the coast of Sydney for quite some time. Next slide, please. So that was our initial experience, and we managed to contain that outbreak reasonably well. But at the end of July, or just around the middle of July, we had a second spike in Victoria, which is one of our southern states. And this was actually, in the end, much worse than our original COVID outbreak, resulting in many more deaths and many, many more cases. And you can see here the double spike, the first here in March, and then moving on to the latest spike. Victoria is still in state of lockdown because they're still managing their cases. Next slide, please. So at the initial spike in March, the country pretty much went into lockdown. There was no playgrounds open, schools were closed, children were being schooled from home, businesses closed, and there were lots of restrictions put into place. Next slide, please. Because the children were quite isolated, people started putting bears into their front windows so that when people went out for a walk, the children were able to do a bear hunt and count the bears in the windows, which gave them something to focus on. Next slide, please. So this is the status. This is actually at yesterday, a day before yesterday. So in Australia, our total number of cases is now around 28,000. We've had 895 deaths up till today, actually, and the bulk of these deaths are actually the result of the Victorian spike. Before the second Victorian spike, we only had 102 deaths Australia-wide, and that second spike has accounted for the large majority of those. We currently have 304 active cases with around about 50 people still in hospital. Next slide, please. So at the beginning of the COVID outbreak in March, we decided to conduct a survey to look at how this pandemic was going to impact on people, particularly while they were in lockdown. And we looked at the areas of interest being how they could access the environment, the impact on their mental health, and some of the challenges, and whether there were any benefits of the pandemic. So we used validated questionnaires, the Kessler-10 and the SF-12, and a lifestyle behaviours questionnaire to assess lifestyle behaviours. And we also collected demographics and asked specific questions around COVID-19 and how it impacted upon people. Next slide, please. So our preliminary results in this study at the moment, we had 105. We're now up to 170 participants. So this is our preliminary analysis. We found that particularly in young women, their anxiety was much higher, around about 50% expressed very high anxiety. only 7% said their anxiety was lower, and that was mostly related to the fact that they weren't travelling to work and they were at home with their families. A lot of people were doing less exercise, so around about 33% were doing less exercise than normal, particularly women, more so than men. And around about 22% of women and 5% of men said that it actually had a positive impact on their life. And I'll talk to you about that in a moment. Next slide, please. So the most commonly reported impacts on mental well-being were that people were missing their family and friends, particularly grandchildren, and feeling quite socially isolated. The inability to visit loved ones or attend funeral services overseas or locally was also causing a lot of stress and had a negative impact on mental health. The ability to work from home had both negative and positive impacts on mental health and well-being, as did the role of exercise. And people felt that they had an opportunity to do more exercise because they were actually working on home, and that was good for them. Next slide, please. So some of the comments in our free text boxes, this one's from a mum who said, it feels like I'm working much longer. I normally work from home, but having the whole family home has made it harder to balance and to take my children to the park and do my exercise. Her work was supportive, but she's been trying to manage children at home and work, and either the work is compromised or I work outside of school hours to get things done, and then my own life balance is compromised. Another participant said she couldn't take the children out to play. We walked to do the bear hunt, but that's all. There's no childcare for me, so it's all low impact exercise. The gyms are closed and so are the parks. I miss the outdoors and my routine exercise. Next slide, please. So our current status is that our states are actually quite varied in their approach to the way they're managing COVID-19. You can see here that Victoria in the dark purple at the bottom here has had the most cases. New South Wales and Tasmania are fairly close behind, with Western Australia and South Australia less, and Queensland very few cases, and again in the Northern Territory very few cases. At the moment, the border closures are varied. So Victoria's borders are totally closed. Nobody can go in or out of Victoria without special exemption. Borders between New South Wales and Queensland are closed, and the borders between New South Wales and South Australia are open. We're still using social distancing over the 4 square metre rule. Masks recommended on public transport. Everyone is required to sanitise their hands prior to entering all premises, and there's still large amounts of COVID testing if anyone feels unwell. Next slide, please. Thank you. That's all I'd like to say, and thank you again for the opportunity to speak to you today.
Thank you very much, Dr. Wilson, for that wonderful presentation and giving light on well-being, especially in the time of pandemic. I now welcome back Professor Wun'Gaeo to introduce our next speaker.
Thank you. So we had a very interesting presentation from the also the sharing the survey, recent survey, research survey from Professor Leigh Wilson. So with this, we will have some discussion later. But at the moment now, may we move on to the next speaker, Professor Emma Porio. Professor Emma Porio will kindly give a presentation on the case of the Philippines, especially focusing on climate and the city. So I hope we will see her, Professor Emma, a beautiful face in a few seconds. Oh yes, now Professor Emma is with us.
Okay.
So now.
Okay, good morning everyone.
Good morning.
I would like to thank the previous panelists also yesterday who had outlined the landscape of the COVID impacts and how it is affected by climate. I would like to thank Professor Teparat and Professor Wilson for basically laying out the COVID impacts to health and to the city. So The title of my presentation is COVID-19, Climate and the City, Challenges to Recovery and Resilience. The presentation I'm going to give today will consist of 4 parts. Briefly, I will look at the national and international context because the previous speakers have laid them out excellently. But I'll go into the community context, the impacts of the COVID and climate on the poor and the vulnerable groups. And then the last 2 parts, I'll focus what I call the science technology pathways to resilience, which I think as academics, as researchers in the universities, must contribute to the solution by looking at our science and our scientific practices in partnerships with the private sector, the communities, the local governments, and focus also on the community initiatives. The last part, basically, I'd like to look at what I call the science technology in the service of society to care for our common home. So briefly, basically, you can see the COVID-19 cases as of October 2020. Yesterday, I was very envious of the presentations of Japan and Vietnam and for their excellent prevention and mitigation performance. So normally, the cities of the Global South are already challenged with population expansion, densification, rapid expansion of the economy, pollution problems, traffic congestion, and social services deficits and the like. In the Manila, we have been on lockdown since March 16, and we are now in the 7th month. In June, in May, late May and June, the monsoon floods and rainy seasons came. So you can see here on June 3, 2020, the headline of the BBC News says, Cyclone Nisarga, storm set to hit COVID-19 ravaged Mumbai. At that time, Mumbai had 50,000 COVID cases in a 20 million population, and the hospital beds were shared by patients that have to be evacuated. And with heavy rains and big storms and big tides, also comes gastrointestinal diseases, dengue and rhinoceros. So basically, the storms and the floods highlight the vulnerabilities of the health and risk governance systems and the vulnerabilities of the poor. You can see here also on June 2, the NHK World Japan headlines. Coronavirus complicates preparation for typhoon season. And really, this is a case that I call biological hazards, like COVID collides with climate hazards and can result into cascading disasters. So you can see here in Hobby was a COVID hotspot. And in June, July, the big floods really came. And you can see there the impacts of the damage and the displacement of people because of the floods as well as the COVID. In India and Bangladesh, Cyclone Samphan destroyed houses, buried a lot of houses also because of the landslides, and it basically made the response to COVID pandemic more complicated, and it demanded more increase in evacuation centers and the like. So in the Ecuadorian Amazon, the flooding destroyed houses, and also it increased hunger and food insecurity because they have to go down the river to get food supply in the nearest center. So also they have hard time getting medical support. In the Philippines, in late May 2020, we had Typhoon Ambo, or Bongpong in international name. And at that time, we only have 11,600 infections. And you can see now we have over 300,000. But really, it displaced a lot, over 300,000 people in regions 5 and 8. And it doubled the number of evacuation centers needed, who were also used as quarantine facilities, taken down because of the strong winds. So basically, you can see here the impacts, how typhoons and flooding really complicate the evacuation process, following the COVID protocols of social distancing, hygienic habits, and the other kind of protocol. It's hard, basically. So you can see there the evacuation rates and also the COVID. So really what I'd like to say is that COVID-19 or what's called this here in Tagalog, ang pandemya. Ang pandemya at ang klima and the poor and the city are so I would say that I always tell my staff that we have a cascading hazard impacts of climate, and it's really challenging the health and governance systems, and it highlights the vulnerabilities already vulnerable poor. So, for example, since the lockdown, COVID-19 have affected 1,500 districts worldwide. In Metro Manila, the high population densities have complicated the evacuation and also prevention efforts because the COVID-19 hotspots in Metro Manila are usually also the flood inundated areas. And the evacuation centers have low supply of food, sanitation, face masks, and in fact, in one case, the Metro Manila Development Authority, who's in charge of the flood control system, some of their personnel got tested positive, so it caused delays of the pumping station operations. The local, the LRT, the train system, 200 of their employees got infected, and it had to cancel the service of the train of the LRT for 1 week to 2 weeks. So displacement and mobility really affected the population, and it really shows that COVID-19, it reminds us that the increasing urbanization has resulted in the transmission of diseases, zoonotic cases from animals to humans, and that we should look at community initiatives and strong social infrastructures in the community because the health systems and the governance systems are very much overwhelmed. So this is the story of the relocatee in the Seaside of Manila. Basically, they were relocated there in 2019. In 2019, they were victims of Typhoon Kitsana. They were relocated from the Tulihan River in 2017. But lately, during the COVID-19, they were also told to destroy or at least destroy the illegal structures at the back. They have put plastic roof and fences and barriers to thieves and floods. But basically, they were told this is illegal. And the people put the fences and the roof to prevent the rains from coming. And if you look there at one picture, the children who were doing online classes had to do it outside, and they were wet by the rain because the signal to the phone was only outside. So I'll go basically to the next slide, saying that what, as shown in the previous presentations of Contiparat and Professor Wilson, really the COVID-19, the pandemic, have heightened the chronic and structural vulnerabilities of the poor. It heightened the weaknesses of the housing and health systems of the city, and it heightens the fragmentation of risk governance systems, national, regional, and local. So I would like to look now at our university and our project. What have we done as engaged inter and transsexual researchers? We have basically decided that as scientists, we have to input and we have to contribute in terms of our science-based initiatives. So we have done basically the climate disaster risk assessment and the social vulnerability analysis that highlight the invisible poor. The poor in the cities are statistically invisible. 40 to 60% of the cities are really informal, and they are not in the formal statistical system. So the distribution of the social assistance program is challenged because they do not appear in the statistics and the profile of cities, which shows who are the poor and who should be assisted. So we've also done technologies for climate and disaster resilience, like the solar-powered potable water systems, the automatic hand washing facilities for barangay health centers. We've partnered with several barangays for that. And then with the web-based, this is a major partnership. We have the National Resilience Center, what we call the web-based geospatial risk data system for COVID risk management, in partnership with Stadio University, Epimetrics, and of course, Ateneo de Manila and the National Resilience Council, the main mobilizer. So you can see here basically saying that the invisible poor really are invisible in the statistics and the records. But if you look at in a map in our climate disaster risk assessment maps, wherein we have the social vulnerability analysis, locating the poor where they are, and what are the climate hazards that they are subjected to, as well as the political and economic and social hazards. You can see here, this is an example of how we have, based on our climate disaster risk assessment, we partnered with Epimetrics and the other universities and the National Resilience Council in trying to come up with this geospatial risk database for COVID-19. So this is an example. We started in June 16 on training the local climate, the local chief executives and planners and city health offices, and trying to lay out the landscape of their climate hazards as well as where the epidemiological hazards are located. So you can see here the Ateneo Innovation Center, I was mentioning earlier. Also in terms of the digital portable library, as well as the the testing of the low-cost ventilator, because the ventilator costs over sometimes from 300 to 500,000. But here, this one that the Ateneo Innovation Center fabricated, it's really just less than 50,000. So I'll just, I've mentioned already the web-based geospatial risk database system, because the government really, the database system of the government is quite challenged, and also in making the poor visible. And then also the Manila Observatory regularly issue what I call context-informed typhoon advisories. For example, we are entering a mild La Nina, and so that is what Manila Observatory is saying. So I will basically conclude now by basically saying that the COVID-19 and the climate hazards really forces us to recast and examine the new pandemic-generated inequalities and poverties. It stems from the fundamental inequities, rural, urban, gender, generation, geography, and the geographies of resource bases and power. So we basically think that our job as scientists, we have to put the evidence out there so that the poor becomes more visible, the deficits become less, and we basically, you can see the digital divide with the online learning now has also widened. So I always say in our program, we have to innovate, but to innovate is to collaborate, but to innovate is also to navigate across systems of power and action. So we should also focus that while there is solidarity upstairs, there's also solidarity networks of LGUs, communities, and the poor. And we should focus on this in terms of what I call in my, with my colleagues, that we should be problem focused and solutions driven with the systems lens. We look at with the people and the policymakers and the scientists as basically collaborators and providing creative solutions. So let me basically conclude by saying my message really to the community of scientists and policymakers and practitioners, that we should band together to construct human security and resilience through our positive, creative, proactive actions using our own expertise and science. So I'd like to close this presentation by quoting Heidelberg when he said, "A true community is not just about being geographically close to someone or part of the same social network. It's about feeling connected and responsible for what happens. Humanity is our ultimate community, and everyone, from the top to the bottom to the middle, plays a crucial role in contributing to our solutions." Thank you.
Thank you very much, Professor Porio, for that lecture. Now, in response to Professor Porio's presentation, we call Ms. Ann Lampitok to give perspective on the experience of residents in a social housing relocation program.
Ina, I told her to just put on the Q&A
All
because
right.
her internet is challenged in the
All right.
location.
Thank you, Doc Emma, for that clarification.
Um,
Now we move to the next speaker, and I welcome back Professor Surichai to introduce.
Thank you. Thank you, Ina. Thank you, Professor Emma, for a very eloquent and also a very passionate call for our solidarity in the context of this cascading hazards and our the basic vocation of scientists. So this is uh, empowering as well as a challenging call. Now I would like to go to our next speaker, Professor Jessica Dator-Bercilla from the Faculty of University of the Philippines in the Visayas. She has been very involved and active as investigator as well in the research on coastal cities at risk in the Philippines with the Ateneo, the Manila University. She is also a member of the pool of experts, the National Resilience Council, which is a partner of the Ateneo, the Manila Innovation Center. So this is much linked, and also we can hear from her involvement, and the lecture will be on localization, COVID-19 challenges, opportunities and approaches in the coastal city. Please, Professor Jessica Dator-Bercilla.
Thank you very much, sir. I'd like now to share my screen. Are you seeing my screen right now?
Yes, we can.
Okay.
Very nice.
Thank you so much. Our presentation focuses on localization, and this is a bit of a case study coming out from what Dr. Emma has already discussed. And this is really a transdisciplinary effort by the team from the University of the Philippines in the Visayas, from Iloilo City Government, Homeless People's Federation, from Manila Observatory, and our other partners in the city. So let me introduce first the city. The city is actually located at the heart of the Philippines. It's a very small island. It actually sits at an alluvial fan. And if you look at the hazards that historically have hit the city, many of them are climate and weather related. Beginning with drought, storm surges, flooding, typhoons, not to mention earthquakes and fire. Okay. And but at the onset, in the initial months when COVID-19 hit the Philippines, the city was given the moniker of the Wakanda of the Philippines. So if you've seen the movie Avengers and Black Panther, it was given that moniker because it really engaged different stakeholders, innovated on approaches, and there was a lot of hope, But along the way, the city, which is also the center of the region, were met with challenges, particularly with repatriates, overseas Filipino workers, and locally stranded individuals who were coming home, and thus the COVID cases rose along that, and then in a couple of months, there was a major oil spill that hit the coastal waters of the city. And the coastal waters are, of course, where many of the informal settlements are. And so over the, just a couple of weeks back, the city had to declare surgical lockdowns. And it's really mind-boggling that despite the best effort of the city government, and different stakeholders, we still have these problems. And so coming together, different stakeholders thought that there might be blind spots. And we zeroed in on the informal sector and the role of communities in this fight against COVID. And why did we look into this. One, we're looking at exposure drivers, primarily in densely populated areas where physical distancing measures cannot be strictly followed. And this is also where the livelihood activities are undertaken in narrow spaces. Then you have the social drivers. There would be very high dependencies amongst the urban poor, and the income earners will be driven to resume their much valued livelihoods, coupled with the lack of social protection and the engagement in high risk taking behaviors. There's a big window for that risk to actually increase. And so the team, the research team, which was primarily led in the city by the University of the Philippines, Visayas, in cooperation with the Coastal Cities at Risk and the National Resilience Council and the Manila Observatory and other stakeholders, undertook a study of social vulnerabilities as part of the climate and disaster risk assessment. But along that line, there was another study undertaken by some of our colleagues at the University of the Philippines that confirmed that local transmission has already begun in the city. And so, added to the already existing climate and disaster risk assessment, we were going to ask a question: what are the socially related factors that will actually drive COVID-19 and COVID-19 local transmission in the city? And so, allow me to share to you first the analysis of Manila Observatory. That in the city they have tried to downscale climate analysis, and have found out that over time, while we will still have rainfalls, we will have fewer but stronger typhoons, it's actually drought that will be a major challenge in the city in the future. And so, together with Manila Observatory, the city government, and our colleagues from the University of the Philippines in the Visayas, and other stakeholders, we reflected upon the interface, between drought and social vulnerabilities, and have found out that areas that are prominently exposed to drought are also areas with high dependency ratio, without level 3 connection, and mostly non-house owners. And water insecurity will naturally impact on the prices of water, which will make it more inaccessible for the poor. And the danger there is that water is used, for disinfection, and this will limit the opportunities of the urban poor to actually follow the health protocols. Then, of course, there's the problem of storm surges because it's a coastal city. And because the IPCC already projected that marine heat waves, will cause a lot of this weather-related and hydrometeorological phenomenon to hit coastal cities. The houses will be in danger, and you are in an area where the dependency ratio is high. Many do not own their properties, and they have they are without level 3 connection again. In the case of the city, storm surges normally drive people to evacuation centers, and then they would naturally crowd. This will again limit the chances for us distancing. Looking at COVID-19 and social vulnerability, the analysis of our peers also say that there are more COVID cases among 20 to the 30s, not under a shutdown, shared by epidemic, according to health studies, and the current socioeconomic policies are actually driving the most susceptible to more exposure to COVID-19. So and you've seen, of course, the context of our the most socially vulnerable. They are contained in enclosed spaces where social distancing is not possible. They are the most displaced due to hazards. And these are also the population that were displaced and moved and forced to move into evacuation centers by the oil spill. And local transmissions are highly possible where they are not able to comply with those health protocols. And of course, not to mention the mental health issues. While we did state about the options, those who came together thought, given the best effort of the city, perhaps you should look at the value of localization, activating local and community-based health protocols that involve community based organizations and volunteers given the pandemic. And so the city government actually includes the city disaster risk reduction and management council actually trying to develop protocols for emerging infectious diseases. This is implemented soon down to the community level, but also the different stakeholders try to make suggestions on how to possibly localize action. And affirming what Dr. Emma said, there's a need to really include the invisible labor force alongside informal livelihoods and services in the statistics of the city. Community by people's and community-based organizations. And then there's a need, of course, to affirm rainwater harvesting, decontamination, with the help of people's organization in this informal settlements. And that there is a special request that for health purposes, non-COVID-19 related emergencies, especially for the urban poor, be made available in a separate facility. And of course, there's also a need to provide a mechanism for the private sector and other stakeholders to work with community-based organizations. And so with that, we do hope that these recommendations will be accommodated by the city government and other stakeholders so that we follow the pathway of localization as a means to reduce further risks and avoid cascading risks and disasters due to COVID-19. So good morning, and I hope that this sharing has helped widen perspectives and deepen understandings on COVID-19, climate, and health issues. Maraming salamat po.
Thank you very much, Miss Jessica, for that very clear and presentation. I was told to welcome back Miss Anna-Liza to give perspective on the experience of residents in a social housing relocation program. Miss Anna-Liza?
Magandang umaga po sa lahat. Ako po si Ana Lampitok ng Tansa Pabahay, Navota City. Ako po ay may 6 na anak at pareho pong senior citizen ang aking mga magulang. Nabubuhay po kami dito sa pagtitindas po ng pandesal at pag-extra-extra ko po sa labada. Minsan po ay on-call tutor din po ako. Ngunit dahil nga po dito sa pandemyang COVID-19, ay nahinto po lahat, nawala po lahat. Hindi na po kami makapagtinda ng pandesal, hindi na rin po ako makapaglabada at lalong wala na rin pong nagpapatutor. Sobrang hirap po, sobrang hirap ng nararanasan namin. Dumating po kami sa punto na halos wala na pong makain at wala nang maisaing. Naghihintay na lang po ipapaubayan na lang po namin sa mga bata. Dahil mas para sa amin po na may edad at matatanda, kaya namin tiisin yung gutom pero yung mga bata po ay hindi kayang magtiis sa gutom. Ngayon bukod po sa gutom na nararanasan po namin, nagtitiis din po kami sa karamdaman po, lalo na po sila inay at si itay ay may nararamdaman po. So, hindi po kami makabili ng gamot, hindi po kami makabili ng maintenance. Kaya, yun po, medyo matagal na rin na tinitiis ni itay yung pamamanas niya. Ngayon po, para po may makain, nagtat pandagdag din po sa makakain namin sa pang-araw-araw na ano ay nagtanim po kami ng mga gulay-gulay tulad ng kangkong, alugbati, malunggay. Pero itong September 29 lang po, nagkaroon po ng ano, demolition po dito sa pabahay. Dinemolish po nila yung mga likod bahay po namin, yung mga bakura namin. Kaya nakakapanghinayang man po pero naobliga po akong tanggalin yung nakatukod na tanim na malunggay po sa gilid ng bakuran kasi kailangan din pong tanggalin yun. So ayun po, dapat daw po kasi ang gusto ng local government namin dito ay open space lamang daw po yung likod bahay ng relocation dito sa pabahay. So sabi nila open space lang daw po. Kaya yun, no choice po kami, nakadagdag po sa bigat para sa amin, problemado na nga po kami sa pang-araw-araw na makakain namin, nadagdagan pa po kami ng problema. Mas lalo po kaming nahihirapan. Ngayon po, simula na ng yung modular na klase ng mga bata. So siksikan po yung mga anak ko po dito sa likod bahay namin na kahit sobrang tirik na tirik yung araw ay nagtitiis po sila kasi wala na po kaming bubong na ano, masisilungan. Tapos po, nagtitiis sila sa araw. Nung halos maghapon po kasi yung klase nila, lalo na po yung mga high school, na halos maghapon silang nag-o-online class at yung 5 anak ko po nandito sa likod bahay kasi iisa lang po yung cellphone na gamit nila kaya halin-hinan lang po sila. So sa isang cellphone, 5 po silang gumagamit, 2 high school po at saka 3 elementary. Eh, nung minsan po na umulan, basang sisiw po tuloy, takbuhan po sa loob yung mga bata kaya yung ibang gamit nila, yung ibang models po nila ay nabasa po. Isa lang po yung masasabi ko, sobrang hirap po maging mahirap. Mahirap na nga po kami, pinahihirapan na po kami ng sitwasyon dahil sa pandemya, mas lalo pa po kaming nahihirapan ngayon. Pandemya, hirap ng sitwasyon, hindi makakilos, hindi makapagtrabaho ng maayos, problema sa makakain, pati po yung sitwasyon namin ngayon na pati yung mga bata naaapektuhan dahil sa pagpapahirap din ng local government namin. Nakadagdag po sa bigat ng kalooban namin na mga residente dito sa pabahay. So, yun lamang po at maraming salamat po.
Salamat, Anna. Salamat talaga sa pagbahagi mo. Anna has been working, I've been working with her since pre-Ondoy and after Ondoy or after Kitsana. So, maraming salamat, Anna. Maraming salamat. Okay, Surichai.
Thank you, Anna. Anna, who so for you, I am sorry that I could not understand the presentation, but I got the word demolition from what you said. Maybe
it's okay,
some fields can,
someone the translation later.
Yes, not now. Okay.
Yeah, okay. Later. Yeah.
Later. Okay. So thank you so much, Anna. We will continue, and then we will have Anna still with us. So we will have a bit of interactions afterwards. At the moment, we are very happy to be joined by our next speaker, who will be our commentator as well, our discussant as well, Professor Nina T. Casilio Karandang. Professor Nina is from the health social science field. She's also a professor of Department of Clinical Epidemiology, the University of the Philippines in Manila. She is also a member of World Health Organization Social Science Working Group on COVID-19. So we are very honored by her participation, and we hope to listen to her interventions now. Please, Professor Casilio Karandang, please.
Kapkun ka, Achan Apil Surichai.
Thank you.
Maraming salamat, Miss Anna. Thank you for all of the panelists ahead of me. Thank you, Professor Emma, also for inviting me. I'm titling my remarks Life in the Anthropos. Can you
Yes,
already
we
see my
can.
slides? Okay,
yes,
thank you.
yes.
The term anthropos means the considerable global slowing of modern human activities, notably travel. This was proposed by Roots et al. 2020. And they say, and I quote, society's priority must be to tackle the immense human tragedy and hardship caused by COVID-19. But we cannot afford to miss the opportunity to chart for the first time on a global scale the extent to which modern human mobility affects wildlife and the environment in general. Respite can help natural systems recover without the usual human intervention. So they're looking at the post-anthropos world, and we may discover that relatively minor changes to our lifestyles can potentially have major benefits for ecosystems and humans. On the other hand, you have the phenomena of plant thieves scouring forests to satisfy foliage-starved Filipinos. So this is in response to the phenomena of the plantitos and the plantitas. Let me quote from sociologist Lowell Julia Card, who in 1932 said the following: how a community response to disaster is determined by its culture, its morale, its leadership, and by the speed, scope, and complexity and violence of the catastrophe itself. Not every windstorm, earth tremor, or rush of water is a catastrophe. So long as the ship rides out the storm, so long as the city resists the earth shocks, so long as the levees hold, there is no disaster. It is the collapse of the cultural protections that constitutes the disaster proper. The deaths, injuries, and other losses that follow this collapse are integral parts of the calamity. So Professor Lowell described the sequence pattern of disaster. There is a precipitating event, a dislocation of adjustment, and a series of individual, interactive, and cultural readjustments working out eventually to a new level of equilibrium. The lived experiences of people all around the world has highlighted the fact that COVID-19 is as much about behavior as it is about biology. The science and art of public persuasion, together with community engagement, are integral to successful responses to the pandemic and beyond. Buhay, or life, and kabuhayan, livelihood, are equally important concerns. Experiences of those who have more versus those who have less in life. They both feel stress, but the sources of stress are different. So we need kalinga, or care, and we also need resilience. Resilience in Filipino is equivalent to katatagan, or your stability or strength, and you have your ability to adapt or may kakayahang umangkop. And I define it also as kagalingan sa kalagitnaan ng pandemya. So kagalingan means excellence in the middle of a pandemic. And for my work on well-being, I define it as a constantly changing process through which Filipinos adapt and thrive and regain a sense of well-being, or kagalingan, in the face of various challenges and stressors: family, social relationships, health, workplace, and finances. Let me end with this slide from Copland and McPeters of Emory University, where they talk about plagues, public health, and politics. In the first part of the slide, you see here A, science informs public health, which leads to political change. And in the lower part, you see B, politics influences public health and it influences science. So this is the improper pathway of developing public health policy. So we need to recognize interconnectedness and use the political system to improve public health through good science. We also need to strongly advocate for wise public policy based on science in the context of broader societal considerations. Good science, good public health, and good policies, and the positive value that politics can provide, all of these three are important. Thank you.
Thank you very much, Professor Caselio Karandang for a very focused and very important, eloquent intervention to make us relate to the key messages before us, as well as to reflect on the the context where we need really to be more responsive in our vocation to the issues. We are now also open for questions from the audience. May I also ask Professor Emma to join with me in this moderating this session.
Okay. Thank you very much, Surichai. I'm very happy to see you. I'm
Thank
very
you.
happy that our panelists, really did excellently. And I would really like to thank Nina for such an excellent summary. But more importantly, I would like to acknowledge and really I'm grateful to Anna for participating in here, because Anna has been I've worked with Anna since before Kitsana or Ondoy, and then from the moment that they were there in the river lines, the Tolihan River lines, and then later they got relocated to the Tansa social relocation site. And I'm very grateful that she shared her experiences, because in the first 2 weeks of the pandemic, she was telling me that they were not having any response. So I mobilized some support, very little, but they have done their own initiative in trying to survive and possibly thrive in this pandemic. So I'm very grateful to Anna and Penina, and especially Jack. Jack we've been working together for the past 10 years. So I'm very happy that, our work with the Iloilo City, and especially in partnership with the National Resilience Council, we're trying to do our efforts of trying to collaborate with the local governments, with the community-based organizations, and with the private sector, in order that we'll be able to come up with a science-based, socially inclusive resilience planning and development initiatives in the local level. So thank you, Professor Surichai. Maybe what are the questions now that are appearing in the Q&A or in the chat?
We are having two questions, both to Anne and also to other participants. The first one is to Anne, why the population is high. Is there a strict policy of the government to lessen population? Is government policy a contributory factor, such as CCT program encourages the boom of population? That is the question to Anne. Yes. And also a question to other colleagues, to our participants. The question is, in the Philippines, what can the local government do in order to remove not only legal but also illegal settlers near the coastal riverbank areas? Is there a policy penalizing those recipients of housing program because some of them sell their rights as owner of housing programs and govern and goes back to the areas in the coastal line riverbanks? Others are making those houses in the coastal riverbank areas as house for rent while enjoying staying in the housing project. Any suggestions? This is from Wilma Benito. Okay, so I just started by the two questions, but we also we are in a way we are clearly privileged to have our say broader perspective of through the presentations from the Philippines, from the affected Anna, and also from Australia. The case of Australia also very important to relate to, and also from Thailand, the case of how the poor, urban poor, especially in the impact of COVID, how they will cope with it. And we also saw the part of social organizing part of the communities, not only seeing the national politics and the city politics alone. So may I just relate all these questions in the context of our perspectives, and Professor Emma help us to relate this in terms of Philippines, as well as the challenges we need to talk in terms of policy and how science in this sense of emergency. Yes, may I open up the floor? And Professor Emma, you can also help me to moderate wherever you feel good.
Okay. Before we start the Q&A, I would like to request those people who are asking Anne about these broad questions, maybe Anne can just, say something from her own perspective.
Sorry, I think that was the question was submitted by Anne, but it is addressed to the panelists.
No, okay, because I think the question addressed to Anne, I think I'd like Anne just basically to, Anne, can you have a little bit in English, if you can, respond in general to the pandemic consequences on your lives and on the social relocation side? You're muted, Anne.
Ma'am, I will try my best to speak in English and to express my thoughts. Okay.
Thank you.
The impact of COVID-19, especially to us, the poor here in Philippines,
the internet connection in their place is not good. So maybe while waiting for her, I will basically say that there's a question about, whether
especially for us, I can explain. Is it clear, ma'am?
Yes, it's clear now, Anne.
Okay. Best to speak in English and to express my thoughts. The impact of COVID-19 for us, the poor here in Philippines, I can
Anna,
briefly
focus
say.
on your community.
Okay.
Anna, can we get back to you?
Fall or 10 times
All right, Doc Emma, I think it's better if we do get back to her and we focus on the panelists first. I'd also like to invite to the
for
moderators, Professor.
the good enough for us because okay, ma'am. Thank you, ma'am.
I'd
I
also
guess
like
the signal, ma'am.
I'd also like to invite Professor Mewako to the moderators for this question and answers portion of the webinar.
Oh, yes, Professor Miwako. Professor Miwako.
Yeah,
Thank you very much
Wilson.
for wonderful presentations for every panelist. I truly appreciate. There are so many questions and comment and so maybe the Professor Surichai Wangamo already introduced the questions, but could you please answer the question to the Mrs. Napara Duram? So the question is, How do we assure the sustainability of a community development project created in Thailand during the COVID-19 pandemic? So, if you have some, answer or response, could you please answer this question? How do you how do we assure the sustainability of community development project?
Oh, thank you for the question. Uh, we have been implemented the for community organization development in Thailand for 20 years, and is for myself, I think that this is can assure that if community they have the role of their own to develop, because they are the one they it's their problem, and so the solution come from them. And if they play the role as the core actor for their own development, this create the spirit of sense belonging of the owner. And one thing is that especially for the urban poor, it's very difficult for every urban poor to just stay alone, because if they have the problem, sometimes they need to have the system in the community to support among them, to help and to share each other. And we have this kind of experience, and we quite believe that this will bring to for the sustainability, especially now when they start that, okay, they cannot just wait for others. And that is the spirit of the community, that they have to help and support each other. And then also they have the network, not just only their own community. But the thing is that now the people in Thailand, both and in urban and rural, they have the linkage between the community at the city level, at the provincial level, and at the national level. So we can see that when some community in the southern part of Thailand have the problem, we have the case of this kind of COVID. And then some other community in the northern part of Thailand, then they send things to help or food or something. So this is the spirit of supporting and sharing, linkage, link the community together. And also the urban farming. This is now quite the norm of all the community that work with CODI, that how they can have their own green farm in their community or green community. So at least they can rely on themselves. So this creates a sense of reliability of themselves and also self-reliant. And I think that this is a kind of the thing that can support towards sustainability. We also have the case, not just only the community, but in the city, for example, in Chiang Mai, where Dr. Surichai now in Chiang Mai, there is the group of the academic and also professional. They join hand with the civil society, and then they use the public space to create the urban farm that can support for the city of Chiang Mai, for the if they have the disaster, I mean that for future. So there's now they think of that something like this, because in this pandemic COVID-19, we found that in the rural area they're not affected very much when compared to the urban poor community or the community in the city. So this kind of uh, spirit, this kind of urban farm is being started, but in the collective way, not just only for individual. And we sure that the case of Thailand, if we see that why it can control the pandemic quite well done on this. Not just only that we have a very good health system, in public health system in Thailand, but the role of the community and also the people, they very well cooperate in terms of taking care of themselves, social distancing, wear the mask, everything. This kind of collaboration between the government and the people. So so that why we can still uh, well done on this kind
Thank
of
you very
pandemic.
much. Yeah, collaboration between the government and the
Yes.
community is very important. Thank you very much. So we have another questions. So thank you, Dr. Tiperet. Thank you. So we have another question to Professor Wilson. So Professor Wilson, the other question, how do you suppose how we address these problems on well-being, especially now there are some limitation of movement and physical spaces. So do you have any ideas?
Yeah, that's a very good a very good point and a very good question. And I think it's becoming increasingly possible here in Australia because we are slowly releasing our restrictions. But one of the hardest things still for us is that we cannot shake hands with other people or get too close, or hug someone, for example. And we are very demonstrative people. So it has been very hard on people's mental health. There are a number of mental health initiatives that have been put into place, particularly because we've had a huge increase in our number of suicides in Australia over these 6 or 7 months. And this is very concerning. In my personal local area where I live, we had 7 suicides in 7 weeks, all in reasonably young people. So there have been a lot of initiatives coming from within the community, but also coming from our local support networks to give people some opportunity to work together within the limitations to try and build resilience against this stress.
Thank you very much. The increasing of suicide because of the COVID-19 is severe, one of the biggest problem in Japan too. Thank you very much for sharing the information. And so now, we have another question to the Professor Emma Porio and Professor Surichai Wun'Gaeo. So this is what can the local government do in order to remove not only legal but also illegal settlers near the coastline or riverbank areas? So is there a policy penalizing those recipients of housing programs because some of them sell their right and owner of housing program? So do you have any ideas?
I will answer it first, then after that I'd request Jet to also make a comment. Number one, basically the local government and its listing of the informal sectors or the poor is incomplete. That's why the climate disaster risk assessment and the social vulnerability analysis that we did in Naga City, in Muntinlupa, in Iloilo City is very crucial. It allowed the city to see who are exposed to the climate and disaster hazards, what are their levels of vulnerability, and what are their capacity. So really for us in CRPH, a climate and disaster risk assessment with an emphasis on the social vulnerability analysis of the city will really make the poor visible. You can locate, you can tell them, the mayor can see where are they located, what kind of vulnerabilities they have, and what kind of capacities they may have in partnership with other community solidarity networks. So for me, when we say science-based, we should have our maps, we should have our location. So it makes it visible because right now our statistics, our Philippine Statistical Authority, it's, most of the poor are not listed there because they are informal, okay? So second, basically in terms of relocation, I really think that we should work together in terms when we say the local government unit, they have the resources and they should really be looking at their climate and disaster, what I call is CCA, climate disaster adaptation and disaster risk reduction programs. Be working together, the environmental groups, the health, the social protection group, and the ecosystems group. They should really work together. So collaboration is really very important, and also sharing of information and databases, and also connectedness in terms of the policies and the programmatic actions that each of the sectors are doing. Because right now, we are very sectoral. That's why in SICAR we say we should be transdisciplinary, transsectoral. We should be connecting and we should see each other in order to have what we call an evidence-based informed decisions and action. Jack, can you follow that?
Thank you, if I may, Dr. Mia. I have here a very interesting problem in coastal cities. So in Iloilo City, we are a floodplain, met by a lot of climate challenges as I have presented. And because many of these informal settlements are very close to shore, too close to the shoreline, they really have, by law, they really have to be resettled elsewhere. But your problem is really space. And so local government must include and mainstream in their development planning the importance of land banking. They need to invest on land. Safer space in Iloilo City, despite the fact that it is a floodplain, the city government really attempted to land bank. They invested on lands where they can have in-city relocation, and this in-city relocation must be linked to transport and livelihood services. But despite, again, that best effort, it is still met by other climate and related challenges like flooding and typhoons. And so, as Dr. Emma Porio has said, working with different stakeholders is very important in order to build climate and disaster resilience in these communities. So I'll end there. Thank you very much.
Miwako, can I just add? I always say that we have to create a new breed of scientists and policymakers and action people, that we should be transdisciplinary, informed by 3 principles of transdisciplinary, that we must co-generate the knowledge with the stakeholders. We must co-create the capacities of both scientists and practitioners and policymakers. Third, it should lead them to co-benefits and co-ownership. I think if each one, the policy community, the scientific community, and the action community, the CSOs and all those groups, if we observe this, then perhaps we're getting nearer to effective solutions. Plenty of brilliant scientists, brilliant NGO leaders, brilliant policymakers, brilliant leaders. But I think we are challenged in terms of connecting, collaborating. That's why I always tell my team to do transdisciplinary action research is to require intellectual humility. You know where your expertise starts and connects, not ends, connects with the other expertise to produce a very coherent actions that will benefit the people who really need so much of our data, our information, our initiative. Thank you.
Thank you very much, Emma. It is a strong message to the audience. So at last, I'd like to ask every panelist to give the one short comment to the audience through the day 2 panel sessions. So first, the Professor Tiparat give us a short wrap-up comment to us. Professor Tiparat?
Yes, thank you.
Very
Yes,
much.
thank you very much for the sharing. I think that the collaboration and also collective management is very important for this disaster and also this COVID-19. And through this, we can pass it together. Yes, and also this is the concept and the philosophy from the community in Thailand. Yes, thank you.
Thank you very much. So next, Dr. Wilson.
Thank you, Professor Miyako. I'd like to say how interesting it has been for me to hear how other countries have dealt with COVID-19 in their situations. and seeing how there are so many similarities and issues and challenges for us all. I'm very interested in Dr. Jessica's climate mapping, and I would love to be involved in something like that here in Australia, because I've done a lot of work with climate and health. But I think, you know, the committee and everybody who's pulled this webinar together have really to be congratulated, because it's been a really, really valuable session. Thank you.
Thank you very much, Dr. Lee. So, Professor Emma Porio, please.
Can you call Jack first, please?
Okay.
Okay, if I may, again, Professor Miwako, I'd like to bring into the table what our community stakeholders have been saying. We should never look at the poor as victims, you know, in all the hazards that we face, that they too have a very important role to play, and that they too have the power to make the difference. This is the call of localization. So whether we're looking at prevention, disaster risk reduction, or recovery, they too have the power to make a difference. So, thank you.
Thank you very much, Mrs.
Okay.
Jessica. So next, the Professor Nina.
Thank you very much, Professor Mariwako.
Thank you.
I'd just like to remind everybody that we still need to maintain all of our different safety practices and the minimum health protocols. And I'd like to call attention to the use of the term social distancing. As sociologists, we know that this is a very different concept, so I always pitch for physical distancing. So we're socially connected but physically distant. So that's important. We wash our hands, we wear the mask, and all of the other protocols. And lastly, I'd like to all of us to remember we're all in this together, and to borrow the Swahili word, Ubuntu. I am because you are. And if we are all together, we can overcome the crisis. The mental health problems brought about by the pandemic will last even beyond the corona. So we also need to pay attention to all of those different effects, not only poverty, but social well-being, physical well-being, and also mental health. Salamat.
Thank you very much. It is wonderful. So let's use physical distance. Thank you. And so, Professor Surichai, could you please give the word?
Okay. I feel we have been very honored by the presentations and the questions. I would like to say maybe 2 or 3 points. The first would I think the issue of who we are as and who are they you see the question there was a question about how to punish the people who seem to not to be a very good recipient of housing program. That was a question from a colleague, Benito. I just would like to bring this in the context of COVID-19 and the issue we are facing. Can we only talk about who should be punished? I think this is a bit too problematic way of asking the question. I think the question is we are all in the same boat now. We are all affected, and the issue is not basically first ask about the issue of punishment. You see that issue of legals are also very problematic because of not adequate listing. In Thailand as well, there are no adequate registration. If talking about the general population, not only about the poor. So I think that this issue is we are all in the same planet. We are all in the same context of COVID-19 now. No advanced country can claim they are above the issue. So we are all This is the first point I would like to make. The second point is the issue about this relates us to see ourselves more belonging to a community as well as belonging to a broader community called human kind. So I really share, and I was attracted by the issue of the word anthropos. Professor Nina brought us to see we are all we are all forced to pause, to take a pause, and how can we make sense of this? The sense making moments that I have gained during this listening to the presentations is very valuable. To say how to make sense of this kind of common experience and go beyond it as a human who also need to deal with the what they call social distancing, but we need more a more correct word of physical distancing. I agree. So that way, I think the human connectedness, not only the physical sense of whatever connections are made by technology or logistics, but I think the human connectedness in the community where Anna worked, and Anna came to our meeting through the human connectedness with Dr. Emma. This is for me learning about how many times they had to be demolished. And this kind of experiences in the communities in the Philippines, it happens in Thailand as well. And how can we bring this connectedness to a higher level of our reflections, and how can we work together more? So may I just would like to end somewhere about how can we move on beyond the specific communities we are engaging. We are my last point related to the privilege to have our today and yesterday meeting beyond the borders, beyond our countries. That is how to feel as humankind, as people who human are all vulnerable in the context of this disaster, but we can make sense and we can go beyond it. And that is the good part, that we can, whatever negative impact on us, we can make sense and we can go beyond it. So we cannot just be talking about how we make money out of our activities, but how we learn about the invisible numbers, like the mental illness or mental health that we are affected, and how can we turn around the mental experiences in a more empowering context, like today I have been feeling. So in that context, the landscape of our experience of this conference, for me, make me feel that through APSA, maybe we can look into a next step of next engagements, going beyond and also learning across borders, making this learning more innovative in the light of you talking about land bank in Iloilo, for example, or innovations of solidarity economy in some communities in Thailand, for example. So all these social responses beyond the state, beyond the usual infrastructure of policy making. So I would like to really to see how we can go into a new exchange of innovations in the context of empowering each other to cope with a more maybe more often pandemic will be around. And so even this be still as human being can do meaningful things together, and how can move this meaningfulness to a new level of our concrete engagement. Thank you.
Thank you very much. So wonderful. The finalizing the word. So Dr. Eva Porio, please.
Thank you very much. I really am very happy today because this conference, brought together a lot of wisdom, a lot of initiatives, and a lot of, I would say, the community resilience driven initiatives at the local level. So thank you very much. I would like to talk of 2 points. One, basically what I talked earlier about the new normal needs a generosity, a new kind of generosity, what I always say to my staff. We need a generosity of the mind, the generosity of the heart, and the spirit, and the spirit, which would lead basically to craft new habits, habits of the body, habits of the mind, and habits of the heart, because we are in a new conditions we've never found ourselves before. And we should look at it for the opportunities that will allow us to contribute to a better community. So I think to contribute is to be open and to be generous, yet conscious of what is your location in society and what are your expertise and capacities to contribute, as well as respectful of the other stakeholders' capacities, vulnerabilities, and initiatives. So that's one. I think it's very important to have that. Number two, as I said in my presentation, I think I was telling my fellow scientists and academicians here, we have to put our science in the service of society so that we can care for our common home. I think that is the call now for the whole planet and the whole universe. Unless we realize that this is the only home we have, and your capacity has to be mobilized in order to preserve the goodness of this home, as well as use it in reclaiming what we have lost and repairing what has been damaged with this pandemic. And really, that's what I was saying earlier. We have to focus on the solidarity networks at the level of the private sector, at the national and local governments, and in the community. I think together we can move forward and construct a better future. Thank you very much.
Thank you.
You're
Thank you
welcome.
very much. Thank you very much for all. So now I pass the word to Ina.
Thank you very much, Prof. Mewako, for managing the Q&A and the closing remarks for the webinar. I'd like to thank everyone again for joining us today in the second day of the webinar on COVID-19, climate, and health. You can see on your screens the evaluation link for day 2 of the webinar and the book of abstracts. It's available at bit.ly/APSA 2020. My teammates have sent this in the chat, so you can click them immediately. We are also uploading the live stream on Facebook, so you can rewatch the presentations from today. And we'd like to apologize for those who were experiencing technical difficulties. Rest assured, we will be learning from this situation. Again, thank you very much for joining us today, and good morning from
So
the
please let me say the closing remarks.
Please.
Oh, sure.
Thank you.
President.
Okay. So thank you very much for all participants, including distinguished panelists and great audience and enthusiastic staffs. I believe that all of you have done through the online today's conference. I truly appreciate Professor Emma Porio, Professor Surichai Wun'Gaeo, and Dr. Zakia Hussain in chairing and convener of great conference. I would like to express my huge gratitude to Ina and Denise and Carol, Jose Maria, and Joko for support, both technical and organizing. I would like to express my sincere gratitude to the member of Ateneo de Manila University. Without you, this conference would never be happen. It is my great pleasure that you had fruitful discussion on global and local issues related with COVID-19 and surrounding environment. United Nations member states adopted the 2030 Agenda for Sustainable Development Goals, so-called SDGs, in 2015. SDGs provide a shared blueprint for peace and prosperity for people and the planet now and into the future. Our two-day conference, APSA 2020, can be said a big step to guide the SDGs 17th goals in some way. We, as sociologists, will continuously engage in these issues which we have discussed today. I'm expecting you to play a great role to make this world a better place. And now, I'd like to announce you that next president of APSA will be Professor Emma Porio. Applause.
Yes.
Yeah.
I think it's under duress, no? I have no choice.
So, I believe she will bring a great positive impact to APSA.
Yes.
Thank you, Miwako.
Thank you very much.
Thank you for your faith and your trust.
Thank you very much for
Only
this great
that we-
event.
Yeah, thank you. The APSA 2020 is closed
And
now.
can we
And
announce
next conference?
next
Yeah, yes, please. Please, Zakia.
I think as a APSA secretary, and congratulations, Emma, for becoming the president of the next APSA and APSA tenure. And we would like to announce that our next APSA, we would like to host it in Sydney. And because it will be at the same time ISA is happening in Melbourne, in Australia. So it was the idea that we are thinking, like Dr. Emma and Dr. Miyako, we discussed about it, that it will be a good idea to host it in Sydney. So I'm taking that on board, and I'll be talking to our university and try to organize everything. I will be talking to Miyako because you have been doing it. And Emma Puri, I believe you have got great capacity and the leadership, so I'll be relying on both of you. And Professor Surichai, hello, I haven't seen you for ages. It's nice to see you.
Good to see
And
you.
we'll be in touch, we'll be working as a team. So that is the plan.
Great.
And we would like to welcome all members to be member of APSA again and continue with us, as well as those who are not member, be member and be with us. And we'll have another successful face-to-face workshop in Sydney in 2022. Hope
Thank you,
COVID is
Zakia.
gone.
Thank you very
and we are all
much.
in health. Thank you.
Professor Miwako.
Thank you very much.
Professor Miwako.
Yes.
May I ask, after the closing of the conference, that you, Surichai, and we can talk about the University of Peace on it, because it will happen in 2 weeks. We will have, Professor Surichai have organized the Mekong panel with Kon Chayan, and then you who will be talking about the Rohingya and also the balance of nature and people, no? So after closing.
Thank you very much, Emma, for you for organizing this great opportunity. So thank you for all. I'm looking forward to the future collaboration and to seeing you in next APSA 2022 in Australia. Congratulations to all. Thank you very much.
Thank you so much.
Thank you. Thank you.
Congratulations
Bye.
everyone.
Congratulations, Emma.
Oh, to everyone.
Congratulations to
It's
everyone.
because of
Thank you,
the generosity of
Especially
everyone.
Professor Emma and the Filipino
Thank
team.
you, Surichai. See you in 2 weeks, okay?
Yeah,
And
see
with
you.
Professor Miwako.
Okay.
Thank you. See you.
And
Thank you. Thank you.